Good evening. This is Dr. Thomas Klein coming to you from Raleigh, North Carolina. I am the senior advisor at the National Pain Council. Our goal is to have people treated again with the only pain medicine approved by the FDA for severe pain. That is the opioid pain medicine group. Medicines that have been in use since before the pyramids were built. There's been an opioid avoidance I don't know what to call it, policy, government policy, policy by, lunatic fringe groups. So we'll talk about lunatic fringe another time with Dr. Peter Pitts. Anyway, we're going to talk about back pain today. In the CDC guidelines for the use of opiates in chronic pain, they only talk about a few diseases. One, sore hips, sore knees, and low back pain. What is low back pain? Low back pain is muscular disarrangement and pain just in the low back. And if it's bad enough, you'll have sciatica, which is pain shooting down your leg. But that's it. Okay? That's a very different disease than the real back pain, the rare painful disease back pain that we're going to describe in our publication 077. That back pain is a systemic inflammatory disease. This back pain is all over. There's fever. There's all kinds of other symptoms with this kind of back pain called adhesive arachnoiditis. That's kind of a long one, but there is a specialist who was attacked by the DEA and had to give up his practice. And so now he's doing research and telling everybody about this adhesive arachnoiditis. If you have back pain that's not just in your lower back, then you need to think about adhesive arachnoiditis, and you can get information by putting in Google the Tennant Foundation. That's Tennant Foundation. This is Dr. Tennant, who is a senior physician and expert in the treatment of pain, and he has little booklets and things, and you can see if you have adhesive arachnoiditis. And if you do, 80% of people will have subtle abnormalities on their MRIs. And remember, they could also have changes in cytokines and C-reactive protein. So there are ways to diagnose this. And this should not be passed off as low back pain. The CDC guidelines did not discuss any of the rare painful diseases except fibromyalgia, which they thought should not be treated. So what are the indications for opiate medicines? We say the word indication in medicine. In other words, what is the proper use? Adhesive arachnoiditis is definitely one of them, in combination with anti-inflammatory. So do not allow people to diagnose low back pain and pass it off, because we don't usually treat low back pain with opiates. The real back pain, adhesive arachnoiditis, has to be treated. It's a different disease. So with that, I rest for the evening. I will see you next time.